So for this module, we're going to be doing a basic transarterial chemoembolization procedure, or a TACE. This procedure is designed to treat HCC, or hepatocellular carcinoma in the liver. What we're going to be using is the same diagnostic tools we did before, here on the Mentis simulator again. Alright, so let's get started. For this part of the procedure, what we're going to use is the base catheter, and this is a 5 French catheter. We're going to use a Cobra 2 or a C2 catheter for this part of the procedure, and then just a standard 035 wire. So we're going to introduce these into the patient. Again, we have right groin access with a 5 French sheath. I'm going to go ahead and introduce the catheter and now the wire. And now you're going to see both items come up on the screen. We're going to fluoro. I'm going to come up with the wire, follow with the catheter. Again, I'm going to come up to the level. For this, we want to get the hepatic arterial supply, right? So we're going to come up to the level of the celiac access, somewhere around T12. We're going to do a little injection here. And you can see there that we selected the SMA. So the celiac should be just above that. So we're going to come back a little bit. We're going to get above that. And we're going to access the celiac trunk right around here. So you're going to pull back just a little bit. Right there you can see we've selected the celiac trunk. That's the splenic. Alright, so we're going to turn our catheter slightly, and then that's going to be, there we go, and that's the common hepatic artery, which we're going to get into here with our catheter. On injection here, you're going to see the hepatic arteries. We're in the proper, and you can see the tumor actually outlining here on the screen right there. So we're going to pull our wire out, and we're going to get ready for the second part. So now we're going to use a microcatheter and a microwire to select the branch that goes directly to supply the tumor. Again, this is a much smaller catheter that fits within our base catheter that allows us to select those smaller branches, and this wire is an 014 wire that we use that has a very soft tip that also is useful for selecting these small branches. We're going to go ahead and introduce this to our base catheter here. And along with this, we have a TUI that's usually hooked up to a sterile saline that's going through the patient. A sidearm flush. Alright, so we now recognizes the wire. Now it recognizes the microcatheter. We're going to take a look with fluoroscopy. You can see both are being introduced. We're getting up into this upward going branch. Now that's the left, and we don't want to select the left. What we want to do is we want to try to select the right hepatic artery because we know that our branch comes off of there. That's the GDA going down. And we're going to try to select something different. What we're going to do is we're going to do a little injection here, just to confirm where we are. So you can see near here the branch that we want to get into. And what we're going to do is we're going to try to manipulate our microwire to get into that branch. And you can see that it's starting to catch right around here. We're going to bring this. We're going to bring the microcatheter up to there, and we're going to change a little bit of our wire angle. We're going to give ourselves a nice favorable angle to get into this branch. Come back just a little bit. And just come back just a little bit farther here. Okay, so after some catheter manipulation with the microcatheter, we're able to get into the right hepatic artery. Right now, we're getting farther and farther into the right hepatic artery, trying to select the branch that directly supplies the tumor. So we'll do a little injection here, and I'll show you where we are currently. I'm going to do a little bit of collimation, the area of interest. And you can see that it's a branch vessel that comes off kind of superiorly, a couple centimeters down. Again, you can see the nice staining within the tumor. So we're going to get our micro wire out a little bit farther, kind of in that direction. We're close. So we're going to bring the microcatheter out just a little bit farther. We'll see if we can get into something that goes straight up to the tumor. And again, we'll come back just a little bit farther, pointing in a good direction. We'll use just a little bit more angle to get directly into this branch. So we'll injection, see how far off we are. So we're right before that takeoff for that branch that goes up to the tumor, right there. So we'll come back just a little bit farther. And then just try to select that branch. There we go. And now we're in the branch that goes directly to the tumor. So what we're going to do is we're going to follow with our microcatheter. And our microcatheter is just right before that branch that goes right to the tumor. We're going to do a little injection here, see what it looks like. So you can see there that directly supplies the tumor. So we're in a really good position now to start our embolization. So we're going to lock down our microcatheter here, and we're going to go to the next step. So for this portion, we're going to start delivering the embolic agent to the tumor. We have a couple different options. We can do conventional TACE. That's where we deliver chemotherapy, usually doxorubicin, in combination with lopiodol, which is an oil, and an embolic. And we usually mix that into emulsion and deliver it that way through the microcatheter. The other option, which we're going to do here on the Mentis, is that we're going to select drug-eluting particles. And the size we're going to choose are 1 to 300s, and we're going to suspend those again with doxorubicin. So we selected those embolization particles, and now we're going to deliver them. So you're going to see me here now slowly delivering through a small 3 cc syringe or 1 cc syringe directly to the tumor. And you can see that I just pulse it in slowly to try to avoid reflux. You know, we can take our time with this just to make sure it's going directly to the tumor and that we're avoiding getting reflux. Because we want to get as little non-target embolization as we can. So you can see here I'm pulsing in, it's starting to collect within the tumor. You can start to see the tumor kind of filling with contrast and the embolic material. Alright, we're going to continue to give, and now you can see that there we've gotten close to stasis. You know, we're risking a little bit of non-target embolization, so we kind of want to end at this point where it's static in the vessel. So it's a good endpoint for us, and that's a good portion of embolization that we did there. What we will do is we'll flush out what's left in the catheter with some saline, to make sure there isn't anything left. And again, we still see good staining of that tumor right there. So what we're going to do now is we're going to remove our microcatheter, and we're going to do another run now through our base catheter again, okay? And we're going to see what it looks like to see if we got a good result. So we're going to open up our collimation, and then for this we're going to do a DSA. So again, I'm going to hold down on the pedal for the DSA. It's going to gray out, and then we're going to deliver our contrast. And now you can see that that branch vessel supplying the tumor is completely static, and that we don't see any more filling of the tumor. And that the rest of the hepatic branches are all patent. So that's the end of our procedure. So I wanted to give you an example of those particles that we're using. These are the 1 to 300 particles, and you can see here that they lay in suspension in solution. What you do is you combine this with contrast, and that gives you your embolic that you use here in this chemoembolization procedure. Now this is usually mixed, and usually this red color when it's mixed with doxorubicin or some other kind of chemotherapy agent.